We recently told you about a crisis here in Massachusetts. Children waiting days for mental health care, sometimes in the emergency room or hospital. And tonight we take a look at why it's happening and what needs to be done to change it. Last fall, 13-year-old Carly Birmingham felt depressed and suicidal. Carly, who identifies as non-binary, shared those feelings with their mother, Gail.
Anything that they looked at was sort of scary to them, telling them that it was a way to hurt themselves.
At 2 a.m, Gail took Carly to Boston Children's Hospital. They were admitted to the emergency department, but there was no mental health treatment bed available. They waited there, boarding, for 7 days.
I was looking for help, and I'm just like stuck in this small little room. I can't sleep, and it just felt like I was being punished.
Carly is not alone. Boarding is on the rise in Massachusetts. It's when a child is admitted to the emergency department or a hospital room as they wait for a mental health treatment spot to become available. This can take days, even weeks.
There really has been long-standing underinvestment in this space.
Amara Azubike is Director of Behavioral Health Policy and Advocacy at Children's. She says that underinvestment is due in part to stigma.
There's not the same stigma associated with a child with cancer or, a child who has a broken arm or a broken leg. There's more sort of acceptance of this child needs help.
Since June of 2020, the number of kids waiting for mental health services in Massachusetts emergency departments has increased by 200 to 400% compared to the same month the previous year, and it's still 2 to 3 times higher than it was pre-pandemic. Some of that is due to the permanent closure of 3 facilities: Providence Hospital in Springfield, Norwood Hospital, and Westwood Lodge. Bed space has also been impacted by pandemic-related measures, facilities taking fewer inpatient psychiatric patients for infection control and keeping patients who test positive for COVID-19 together. Right now, there are 357 inpatient psychiatric beds in the state for teens and children 18 and younger. 17 more have been licensed since the beginning of the year. Azubike says these are positive steps, but more investment is needed, and one way to do it, using funds from the federal COVID relief bill.
There are billions of dollars coming into Massachusetts right now. Can we think about children's behavioral health care when we're allocating some of those resources, really calling on state lawmakers and the administration to set aside significant resources so that these EDs, these medical floors, could be staffed with the appropriate workforce.
The struggle for solutions continues as teens like Carly struggle to get the care they need. After a week in the ED, they spent another 7 days waiting in a different hospital room, finally being placed in children's inpatient unit for kids in crisis. Carly's time there helped, this drawing a reminder of those days and their goals.
The whole building the bridge part is kind of just working on myself to be able to do things that I want to do. And this time it was, to be able to get home and have everything go back to normal.
There is pending state legislation that could help address some of this crisis. So the bills would gather data to understand how many kids are boarding, the level of care they need, the beds available. On a community level, there are some things that you can do. First, don't be afraid to have a conversation about mental health. It helps reduce the stigma. And then second, tell your lawmakers this issue matters to you and your neighbors.